If you're missing teeth, whether it's dentures or implant-supported dentures or implant-assisted dentures, I customize the treatment plan for that specific patient. And I'm going to break down each option for you. Number one, an implant-supported denture where the denture is actually screwed in. You got the bone, we're doing 4 to 6 implants, and we're screwing it in and you're good. The other option is a implant-supported denture where you have 2 to 4 implants and the denture snaps in. You can take it out and clean it. If you don't have enough bone, you don't have that width or depth, then you have to go through bone grafting. In my opinion, the worst option, but still is an option, is to do just regular dentures. When you have a tooth removed, your bone will start to recede and resorb. When that happens, every year of your life, you lose more and more bone. So you'll see dentures that at first, just a regular denture, and as years go by, they keep relining them because you're losing more bone. Now the denture's getting bigger and thicker because that plastic or acrylic is making up for all the bone that you've lost. In my experience, patients ask, well, Dr. Mantis, what's my best option? In my opinion, the best option is the one that's going to be long-term. And if you have enough bone, then the best option is going to be to do 4 to 6 implants, screw the denture in, and you're set. So if you're looking to restore your smile, come to our office and we will set you on the right path.